Sweet.
If you have like particular boards.
Story.
Okay.
So there you are.
So you're part of the group.
Yeah.
Well, I saw.
Those are the.
Well, I'm absolutely nothing, but I just do my thing, so. I'm a nurse educator. So I'm a nurse, I go where I go and do what I do. What's that word? Starting tomorrow, I can't even pronounce it. Body's telling me I need to go.
Today?
Too much work.
Oh, that makes sense.
Program and that whole.
Oh, I'm a pretty busy guy, I just think I'm tired, I couldn't sit when I had TV.
Exactly.
Yeah.
And nobody could afford me, so I went, okay.
I was programming.
I used to do a lot of things that now.
I had a mullet for the kinetic race and I find that, cut it off. Yeah. It's been a while since I've had short hair.
Oh, goodness.
Oh, okay.
Sorry. It blows my mind how. And then he left, I was like, on and came back when I was travel.
Carol Farmer. Oh, yes.
Africa, India, Nepal, places like that.
We're gonna be secretary of my
Here
church.
for 3 years, but came back before first grade, so.
I belong.
Yeah.
My parish, but I'm not sick. I examined this, I studied, and sometimes over here. That's not fair. So I am. Well, it's not a kind of about last time you're done.
I know.
It's cards there, I also. Yeah. So they got the first two there, but I had my dog and I invested there.
Either.
Graduated. 4 years, she's in a big girl senior position and she's.
Well, if she attends the two
Yeah.
days next
That's
week.
amazing.
I like that, yeah. I was like, I'm freaking.
Good, how you
But I also wasn't
We're
having a those on. Yeah.
It's not happening.
I bet you should, yeah, it's gonna be very popular there.
Really.
Oh, all your folks are
over there.
Ding it.
You're looking snappy.
I'm sorry.
How are you?
I was the Alcohol Drug Administrator of Sacramento County.
Yeah.
And when I left, I really was. And I thought, I know this stuff. I don't know.
Came back from the first.
I wanted to keep so when I come over here, I wanna, keep
Shifting.
my fingers in the pie. And we have.
I run a month situation, so I got to keep it up for it to go through.
Okay.
So I'm quite happy with where I'm at.
It's good.
Awesome.
I'm not thinking of making any crazy changes.
Yeah.
Big counties.
Right.
So we have a lot.
Big deal.
Exactly.
But I'm not.
Are you,
Because
Well, have you been up?
something's better than there because.
Finish the connects.
Yeah.
It's not some of that.
Austin.
Yeah, just do out there in the sector.
Crafty.
Yeah.
I don't have any of that engineering. No.
Oh.
Yeah, Fowler's works there.
Kelly?
So, we go.
I
We go back
Which,
there.
I was out there, Sunday, y'all were going into the water, which one?
Drag strip divas.
Okay.
There's like a black, looks like a dragster car with.
Yeah, yeah.
hot
I don't
pink.
like this.
Mhm. Okay, that was y'all, all right, all right.
Yeah,
I enjoyed y'all.
it was fun.
It
was exhausting.
The whole
It
event
was fun.
wonderful.
I go there. I'm gonna go on investigation.
I took Tuesday off to sleep.
Sacramento.
And I went to work yesterday and about halfway through the day, I was like, nope,
I know,
gotta
I
go to
was
sleep.
the other day.
Yeah.
Oh, yeah, I'm old.
And then I.
Come back, guys.
Just cause I'm hauling this stuff all day every day. And I got like drop around at work, it's all these like, it's not really work.
Oh, yeah, cancer runs definitely in there.
So
So far, all the spots.
Caramel drizzle.
I got sugar. Hello, how are you? Got sugar.
Hello, turn on, hello.
Oh, I guess I should. Yeah, that'd be good.
I don't think I have it.
Right, sun, no shade.
Oh, that's not true. Oh, no, it's been. Yeah.
Awesome.
Leave it, turn me off. Friday.
I knew it was gonna be back when the little fall in. Some. When you check. I was like, oh, God, we're gonna.
Maybe,
Yeah.
but I did want him to go against.
Well, maybe not prepared for it. I was glad to read that because I hadn't seen it anywhere and I was reading it.
Yeah, I was too.
Yeah, it's happening. I had to be doctored getting it. Is it your first time meeting?
Not here, no, I came in.
Right?
And then I put it in your.
Oh, is that-
Again, I'm here for the never trying to.
Well,
Going on.
it's something that I do to honor myself.
I focus on what I.
Every now and then. I don't drink a lot of
See
coffee
you next time. Yeah. That's.
It's not healthy for you.
That is very huge.
Yeah, that's not just.
Yeah.
Yeah, this is the second. This is my fun stuff. My husband paid my tuition, so I have.
Yes, because it's echoes and it's like.
And there's some over, there's all these people that only come on the.
Exactly.
So it was like.
Whatever you do, Zoom.
It's not me.
Zoom.
I wonder if they could really.
But everything's going Zoom. People don't have.
I'm a bummer.
It just has to say,
Oh.
Maybe it's the school.
But yeah, our ability to control.
Too much.
We do not have the someone.
the sign-in sheet said April, so I gotta put the date next to where I signed it. I don't know if it says April,
Hi, Kelly.
sign-in sheet, so.
Hi, Danette. No worries.
I do want
I'm just gonna let you know, see if you want to pay nice and direct it, or you guys turn up a fill in April meeting. Or detail oriented, just.
Yeah, me too. Correct, thank you.
Yeah, no worries, no worries. I just didn't know if it was. Honest air or whether it's.
Take it here.
Gary, looks cute. What do you think? It's cute. I like it. Oh, good stuff. Yes, yes.
So they see, they're like, maybe I don't want to pay for that.
That's great. I gotta remember
The
that.
things that we get our heads into. You really want my personal stuff?
Jesse, red hair.
Thank you.
Love it.
Hey, rocking them, okay. I like it. So kidding.
I think people on the
I know, I took a little power nap on my lunch break, that was bad, bad.
And then the percentage is have to be here as a form. And only get passed and then the you have anything. It kind of depends on like how many are here, the percentage of that, you know what I mean, so.
Can you with people, this was.
Yeah, no, I would say most of the people on this is about this. People who, this is not always been true, are people who, in one way or another.
Season and on the floor.
Used to playing with my cats.
Yeah, he feeds one next to my
There's,
stove.
Yeah, same way.
Yeah, it's great.
Yes.
Yeah. Break up stuff that happens in my birthday.
All right, welcome everyone to Behavioral Health Board meeting. I am calling this meeting to order at 12:16. We'll start with our intention. Before we begin, we take a moment to acknowledge the time, energy, and commitment each of you brings, and to set the intention that we show up as trauma-informed, compassionate partners in this shared work to improve behavioral health in our community. Thank you, Gus.
No, I was in the seat for better than.
Welcome to the monthly Behavioral Health Board meeting. We are the advisory board to the Board of Supervisors. We hold this meeting on the fourth Thursday of each month, and it runs from 12:15 to 2:15. We meet in person at 507 F Street in Eureka. This is a public meeting and everyone is invited to attend. Members of the public may participate remotely. The minutes and the agenda can be found by searching Humboldt County Behavioral Health Board online. We provide time for public comments early on the agenda. Public comments are limited to 3 minutes and pertain to matters related to behavioral health. We ask you to make your comment in a respectful manner. Please note this meeting is being recorded. Please contact myself or any behavioral health board members if you have any questions about our work as a board. With that, you will take the roll.
Sean Berger, here. Marguerite Story Mason,
Here.
I'm not.
Oh.
Bob Doherty,
Here.
Raphael DiCaprio. Juan Montana,
Here.
Natalie Arroyo,
Here.
Tony Johnson,
Here.
Matt Kellerman,
Here.
Elaine Price,
Here.
Peter Stahl,
Here.
Joshua Rosenthal. Yes, we.
Here.
Wonderful. Is there anything you want me to say about the chat? Like,
Just if it's like a quick question that you can respond to, or if it's during public comment to make sure that we hear what they have to say.
gotcha.
Thank you.
Now, introduction of staff and guests. We'll start with you.
Hi, Emmy Boston Rogers, Behavioral Health Director. This is everybody.
Everybody, my name's Oliver Gonzalez, Behavioral Health Program Manager.
Yes.
Amy Scott, TA Case Manager.
I'm Cheryl Sturdivant. I'm a nurse in the community. I also work with adults with mental health disorders.
Laurel Johnson, I'm an analyst engaged in test admin.
Alan, do you want to introduce yourself?
I'm Al Miller, from Bear Rancheria. I run the transitional house and I'm be switching over to be a social worker for Bear Rancheria.
Hi, I'm Lorraine Zeller and I'm still new to Humboldt County. I've been working on a project in Santa Clara County to improve living conditions for behavioral health clients living in unlicensed board care or room and board.
Thank you.
Saul Lopez, Operations Finance, I'm the site director.
Hi, I'm Paul McNacky, Deputy Director, Behavioral Health.
Awesome. Then we'll go online.
Hi,
Well,
Alice.
Jack
Oh,
Brazil,
yeah.
Deputy Director for Behavioral Health.
I'm Jeremy Nilsson, also Deputy Director over Children's Behavioral Health.
Hi, Sharon Wolf, Legislative Analyst for DHHS.
Alex Oliveira, BHSA and Quality Improvement Admin Analyst.
I'm Juliana Nelson and I'm Supervisor Natalie Arroyo's intern.
Is there anyone else online who would like to introduce themselves?
Alexis, I'm an HETC YAB member.
Alrighty. There's no one else. Are there any adjustments to the agenda? Seeing, hearing none, we will go to public comments. Is there anyone in the room who would like to make a public comment?
I could just say I'm impressed with the amount of turnout, so yay, Humboldt.
Thank you.
Oh, I'd like to say something. Well, I don't want to but the county of Santa Clara has only the special people at the table. And regular people like me get to sit at the table. So I mean, I'm special too, but so I really enjoy this smaller town kind of ambiance. Welcome.
Any public comments online? Righty. Okay. So with that, we'll move to action items. Need to approve the minutes from the 4/23/26 meeting.
Make a motion to approve the minutes.
Thank you, Sean.
Second the motion.
Thank you, Peter. All in favor of approving the minutes, say aye.
Aye.
Opposed? We approve those minutes. Next up, we have approval to send membership applications to the Board of Soups for Alan Miller, Eddie Morgan, and Saul Lopez. It's, I would love for, each of you to just briefly indicate who you are and say a few words.
Sure, so first. Well, a couple years ago, I met Laura, she helps out with some issues we're having at our facility. And then she invited us to join the board of, mental health. At the time, I couldn't personally apply, but Bob here is new to our company back then, and he seen these qualifications, and so we sent Bob and he accepted it. About a year ago, I started attending these meetings and my schedule changed, and I just want to get more involved in our community. So that's why I applied this year, and hopefully I'm up for application. So yeah, thank you, everybody, and look forward to working with all the community here. So it'll be great. Thank you.
So. Say a few words. Sir?
My first name is Leonard, but I go by Alan. I grew up in Scotia, watched our towns, what it is, what it is not. Eventually went to a foster home. And really looked at my options in life and just started working. I remember walking over here from Pacific Choice, working 13-hour day to Manila, where I was living in the bushes. So if anybody says can't do it, can do it. And that whole fishing season was over, and I got a job in Kennedyville, still living in the bushes, got a bike, and rode every day to Kennedyville. And anybody remembers Grand Auto? Was bought by, went to work for them, then the buyout happened for CSK, but I rode a bike every day to Kennedyville for that too. And so eventually I became a manager. Then got on tribal council and started doing foster care, thought I could navigate waters for new kids. We're like sitting on tribal council for 15 years, like cartoon cats and dogs fighting. So I figured out that I needed to go to school, and that's where I met a legend in this room. Well, We gotta talk about that. I was going forward trying to advocate for our native people. Somebody was always there trying to make space for us to be out. So I'm a We Out child member. Also belong to Bear River. I come from Europe. We're all related. But I'm also Swedish and Italian, old Morandi. Right? My family's almost extinct. So the whole mix went to school. That's how I met the legend. Right? Because we got to do something different with the addiction. Felt inspired. I started doing foster care again, got called up down the Bear River. So at the same time, it's like I appreciate everybody that's all this work because us as Native people are always been like the third, fourth, fifth class people. I know there's been a whole huge movement for We Out, but to remind people there's just as many We Outs at Bear River Ranch Brigade. This is a table bluff, and we're all related. Almost everyone does. So at the same time, it's like, how can we work together because of our federal funds out there, and that if we as a nation came together, how much we could really achieve. And it's about communication, and that's me. Love to hunt and fish, take my kids water right. Do drugs, I don't drink, smoke cigarettes and Starbucks, I drink Starbucks. That's bros better though.
Thank you, Alan.
Thank you, Alan.
Councilperson at the table, I guess, that has done so much beautiful things for We Out people. Thank you for identifying. Awesome. And everybody else that recognizes We Out country too. Thank you.
Thank you. Welcome.
Thank you.
Eddie, are you online?
Don't see Eddie.
Okay.
That same Mr. Morgan that used to be on phone. Morgan.
I'm not sure, but maybe, I don't know.
It goes now, Eddie?
Well, yeah, and he's been attending quite regularly, but, so with that, can we do everyone together or do we have to do separate? We don't have to go to approve. I need a motion to approve.
Make a motion to approve the 3 applicants.
That's not you.
Oh, yeah.
All right. So if, I will then ask for the vote, unless Kelly has something to say.
Yeah, Vernon had his hand up, but I don't know, do we do that afterwards?
No, it's been addressed.
Okay.
Thank you.
So, everyone in, approving, say aye. Aye. Opposed? With that, we will send those 3 members to the board of state. And with that, we will be a full 15-member board. Nobody quit her.
That's awesome.
I know.
Yeah, yes.
Thanks to the legend, Laura.
Doing that. All right.
Big.
I'm gonna kick you into this. Okay. So now the moment we've all been waiting for. Oliver, are you ready? The VHSA public meeting and update. Thank you, Oliver.
Well, good afternoon, everybody. Thank you so much for having me over in your meeting space today. My name is Oliver Gonzalez. I am a program manager at Behavioral Health Branch, and I oversee our local Behavioral Health Services Act dollars. In today's presentation is part of our kind of our closing, right, our public hearing, right, of our 30-day public comment period, specifically on the 2026-2029 HSA integrated plan. So in today's meeting, I have 4 objectives I really want to address with y'all today. The first one is I plan to discuss our BHSA requirements, which are pretty new, along with our planning behind the scenes. Today's presentation also I want to highlight is not really going to be focused on comparing BHSA to the MHSA. It's really just going to be specific to the BHSA and what it entails and how what programs we're planning to fund in this upcoming fiscal year. However, I also want to highlight that We do have some packets out front. If you pick one up, there is some additional information there, and it does contain some comparison charts of the MHSA and to the BHSA. So just wanted to highlight that resource there for you as well. Additionally, another core objective that we have here is I want to go over some data with you. More specifically, how did our community meetings go, right? We also launched a community survey. So there's a couple of charts and graphs I would like to share with you and just sharing what the community members said while we met with them. And then last but not least, the most important part I feel is an area for comments, questions, and overall input from you as a body or from the community as a whole. While we're on that subject, as far as input goes, we do have a demographic survey that can actually be found at the end of your package. You can just rip it out when you fill it out and just listen at the end of the meeting if you'd like. There is a section for comments as well in the end too. So if there's something that you want to really highlight as far as that feedback goes, that's just another area for you to do so. For our friends who are joining online, we also have this in a virtual format, and my colleague Alex Oliveira will be putting a link along with a digital version of this packet in the chat for you guys as well. This survey is absolutely voluntary and anonymous. And as I mentioned, the end of the survey has a section for comments. And this is just a snippet of the online version so that, again, our friends joining us have that ability to see where that's located. Additionally, we have an email address, bhsacomments@co.humboldt.ca. That's an email address that's monitored by both me and Alex, and any additional comments that you may have, recommendations or pieces of input can be sent there. We will also be taking notes of any verbal comments made in today's meeting. One thing that we would like to ask of you though is to please keep comments specific to the integrated plan. So with that information out of the way, let's kind of get started talking about that BHSA, what it entails, what it does, and what we'll be funding with. So a little background, the BHSA originally was called the Mental Health Services Act. This was done through Proposition 63, which was approved in 2004 through California voters. Fun fact, in 2004, I think I was in the 3rd or 4th grade. So telling myself about it. So
You're not.
So Proposition 63 went live in 2004. It created something that's very unique to the US actually, and it's only seen in part in 2 other states, such as Washington. And it created a 1% tax on income exceeding $1 million with the intent of funding behavioral health services that would otherwise not rely on Medi-Cal reimbursement. So that was Proposition 63. Proposition 1, though, came into play back in 2024 and then passed officially 2025. Proposition 1, what it ended up doing is it restructured the Mental Health Services Act into what we now see as the Behavioral Health Services Act. It's a pretty substantive reform with a lot of different regulations for counties to follow. However, the intent of that 1% income tax on income exceeding $1 million is still very much the soul and spirit of the BHSA. As we see here in this infographic, we have that collection of that 1% income tax funneled through the taxes in terms of with the California State Treasurer, and then it's subdivided into 2 separate buckets. So we have one bucket that's a little bit smaller, that's 10%. And that's allocated to statewide agencies to operate their own internal processes, such as the Department of Healthcare Services, the California Behavioral Health Planning Commission, the California Department of Healthcare Access and Information, the Behavioral Health Services Oversight and Accountability Commission, and the California Department of Public Health. So all of those get part of that 10% allocation. And the other bubble here that we see on the right here is a 90% allocation, and that's what gets divvied up to all 58 counties and 2 city jurisdictions using some fancy population formula. So just wanted to kind of show you kind of like the big picture of how these dollars get allocated to counties. So as far as these dollars go and what we plan to do, right, we intend to expand best practices and recovery focused mental health programs. We reduce long-term negative impacts resulting from untreated mental illness, and we prevent mental illness from becoming severe and disabling. Additionally, we have some pretty important county requirements that we must follow. The first one is we need to do an integrated plan every 3 years. This is very reminiscent of MHSA, actually, where in MHSA, we call it a 3-year plan, which that actually happened back in June 27, 2023. And fun fact, that was the first plan I was involved in, so it's just kind of crazy how fast time flies. Secondly, we also need to be doing annual updates in between years. So we're gonna be doing 2 annual updates after this integrated plan passes, for those in between years. And last but not least, we also have something fancy called the community program planning process. And that is really like that part of the heart and soul of the BHSA, which is soliciting feedback and input from community members to make sure that whatever we're planning is responsive to local needs. So here I have a breakdown chart of what the BHSA entails. And I want to say too that this chart is showing 2 separate things at once. One is showing that 90% allocation going to counties in general. And then it's showing the 3 core components that the BHSA and really is made out of, right? And that adds up to 100%. That's 100% of the dollars that we get as counties. So I just wanted to make that distinction as to why the number on top doesn't add up to 100%. So here we have 3 core components. We have the housing interventions. We have which is really intended for rental subsidies, operating subsidies, shared housing, family and housing for eligible children and youth. Then we also have our full service partnership services, which I'll get in detail for all these 3 buckets. And then we have our behavioral health services and supports, BHSS, which is 35%. And that accounts for a plethora of different services that I'll also be addressing in today's presentation as well. And these percentages and how they're broken down, that is per state regulation as well. So just wanted to give you a heads up as to why those percentages are the way they are. So here we have a breakdown locally, and I wanted to say too that your packet in front of you also has these figures as well, of what each bucket under the BHSA for us will have as far as funding goes for this upcoming fiscal year. So housing interventions is about 3.3 million, full service partnership is 3.9 million, and again, behavioral health services and support is also 3.9 million. So that's accounting a total of $11,273,841. I also want to emphasize that this is very much just draft numbers. Any budget that's draft is not incredibly super accurate, so I just wanted to give you guys that heads up. In case maybe once you see the plan finalized, there's a couple of differences and changes. So now I'm gonna kind of give you a breakdown of each individual bucket within the BHSA. So the first bucket that we have here is called the housing interventions, HI. That's accounting 35% of overall BHSA dollars. And this is ultimately the newest bucket or newest change that happened when the BHSA passed. The intended purpose of this bucket is to reduce homelessness amongst BHSA eligible individuals. It emphasizes permanent supportive housing and housing first principles. And there is a lot of coordination that we need to be doing through managed care plans. For us, that's partnership of Humboldt County, specifically because there is an offering through this system of transitional rent, which our home program through social services is doing a tremendous job assisting us in navigating. And additionally, this bucket can fund rental subsidies, operating subsidies, support development of new housing units, and outreach. For us, or in general for this bucket, in terms of eligible populations, we have several here. So we have chronically homeless, experiencing homelessness, or at risk of homelessness, individuals exiting institutions or carceral settings, or those transitioning from medical transitional rent, which again is kind of a new dynamic that we're currently navigating with our home program. Priority groups. So we have children, youth in the juvenile justice system, child welfare, or at risk of institutionalization. adults or older adults in or at risk of justice system, conservatorship, or institutionalization. And one note that the state really wants us to emphasize here is that housing intervention dollars originally were used by our full service partnership under MHSA. The expectation now is that these dollars are now going to be made more broadly available to a broader population described above, which presents some challenges, which I'll be addressing later in this presentation. But I just wanted to emphasize that this category in practice, it may look new, the dollars, however, are not. So just really wanted to emphasize that as a challenge and as a clarification. So as far as allowable housing settings for that housing intervention section, right? We have two core components. We have interim settings, examples including hotels, motels, non-congregate shelters, recuperative care, peer respite, to name a few. One point that I've kind of mentioned a couple of times already too is that coordination with managed care plans. The idea is to have a system or a process in place where eligible individuals can go and get a 6-month transitional rent benefit first. And then after 6 months, on month 7, they transition to PHSA funding under this category. That's kind of the system that DHCS is wanting us to implement. And that's what the home program is assisting us in doing behind the scenes. So just wanted to really highlight that mechanism. Ultimately, what our endgame is transitioning people to permanent settings. And that's what we have here in the second category. Permanent settings transition is required after the 6 or 12-month DHSA interim funds are used, right? And then examples of these permanent settings include permanent supportive housing, apartments, accessory dwelling units, shared housing, recovery/sober living, assisted living, and even tiny homes. So again, just wanted to highlight that section just because it's so new and there's a lot of moving pieces in it. Bernie, you had a question?
I have yes, I do.
Yeah.
Can you elaborate what you mean by shared housing?
Yeah, so there are several settings, right, where they could actually have multiple units in one location as an example, right? So that's kind of speaking of on that even if there's multiple units in one specific location, that still counts as a permanent setting.
Okay, thank you.
There's one other question.
Yes.
So does this include trailer parks?
I'm not aware of that term.
So there's trailer
Oh, trailer parks, sorry, yeah. I believe it could. The thing about trailer parks is that I know that parks have like agreements, right, and all that too. So I would imagine it would include them. I would just have to confirm with our home program and our housing team over at DHHS admin, unless anybody else kind of knows that information.
No, I just had 2 questions.
I mean, I know
But-
home has used funds in the past to pay for space rental in mobile home or trailer parks.
Yeah, and
I imagine that would.
yeah, and although I haven't seen it explicitly mentioned in regs, I would imagine functionally it would. But I can double check and follow up with you.
These are the utilities.
Thanks.
that Qualifies, there's no utilities and.
I think you were first.
Yeah, I had 2 questions. One, when you're talking about the transitioning from the 6-month on to the other, the MCP transitional, does that individual transfer or just the way you do it on the paperwork?
Yeah, great question. So it's a mixed bag. It's technically both ways. So what would happen here is they will go from an interim setting to a permanent setting, right? So there would be a transfer in that capacity, and also the funding source would shift from managed care plan partnership to us here at the county through BHSA dollars.
Okay, so the person does have to transfer as well with that. Second
Exactly.
question I had is, when you're doing that shared housing at a location somewhere, do you have oversight that someone's gonna be monitoring and helping those that are in that shared living spaces?
Yeah, my understanding is that oversight does happen, whether it is through case management as an example, there is some type of layer of oversight.
A question?
Yes, I also am concerned about the oversight. I'm wondering if there's enough case managers to really look after what's going on. Also, room and board, does room and board qualify under that permanent housing, shared housing?
We don't really have a lot of room and board houses here currently, do we? Like, we had some in the past that have all since closed down. I don't know.
We have a board and board, we don't have a wing.
But that's licensed.
Only licensed ones are TRTS.
Yeah, and I would imagine room and board would fall more under the room setting as well, I would imagine. Depending on the setting, of course, but I would believe that would fall under.
Yes, in Santa Clara County, they're getting the transitional rent, but.
I just was gonna say, my understanding, just based on having worked in housing services for a long time and reading this, that I don't think they have to go through interim setting first if they have a permanent setting to go into. Is that correct? Cause that would be counterintuitive with the housing first model, which is what it says they're promoting. So like if they can go immediately into a permanent supportive housing setting, they don't have to do this 6 months of interim.
You're
setting
absolutely
first.
correct on that, and that's a really important distinction. I think functionally, right, and applying it, whether or not there will be more permanent settings available from the get-go versus interim settings, that where we would see that maybe as an outlier potentially. But you're right, that's 100% a very fair distinction to make.
So you said the first 6 months of funding is for the managed care. Does that still have the kind of same flexible entrance at point? So the expanded definite, right now, like just minute home, you have to be chronically homeless, right? Very strict definition. So for those first 6 months, does that expanded definition of like almost homeless or currently homeless count for managed care?
I would believe so, yeah, it's a very broad definition. They broadened that.
I'll just add, so, what Oliver's presenting is kind of how the funding's used, but he's not necessarily the one with all the details around programming.
Okay.
And so that could be another conversation with program staff that actually do this work, whereas he's just kind of sharing how the funding is being used to support our system.
Yeah.
Thank you, Oliver. So a reliable source, I haven't seen it yet, but a reliable source told me a couple of weeks ago that HUD published an article that they no longer support housing first. So how does that impact housing first model?
Yeah, that's a great question, and honestly, that's news to me, honestly. I would need to touch base with, kind of like Emily mentioned, with the programs kind of leading the way in terms of making these arrangements. But it is concerning that there are other initiatives or other changes happening behind the scenes that may or may not contradict with each other. So.
Any kind of change to this practice would come from Department of Healthcare Services, like an information notice to initiate that change in counties. So right now, we're not aware of any changes from that information.
This is state, not federal, that's federal, and yes, there is some talk of some of the changes, but that's how our vouchers are handled too, but it hasn't been implemented yet that I'm aware of.
And that's a really important distinction, federal versus state funding, right? With the HSA being strictly state funding, same with where the managed care plans are going to be utilizing.
And in the chat, I think it's Jack Brazil, we actually didn't have his last name, but said Kelly's correct, we don't have any non-LPS board and care homes. So.
Thank you, Jack.
Perfect.
Appreciate it. Thank you.
Just have one more quick question. When exactly does the fiscal year that this is from?
Yeah, so this is effective July 1st, 2023. So that's in the fiscal year, so literally in like a month.
Okay.
Yeah, yeah. Great question. Any other questions? Okay, so now let's pivot to our next bucket here, and that's called the behavioral health services and support, which accounts 35% of overall funding. This section is really intended to serve children, youth, adults, and older adults. It focuses on early access, stabilization, and preventing of worsening conditions, and also preventing escalation to crisis, homelessness, or justice involvement. What BHSS funds is a pretty broad blanket, actually. So we have outpatient mental health and substance use disorder services that we have flexibility on. We have outreach and engagement, workforce education and training for our internal behavioral health staff, early intervention programs, and also innovation pilots are included all in this section as well. With this in mind, one really core distinction I want to make here is that at least 51% of overall BHSS dollars need to be allocated to early intervention. And then out of these funds, a minimum of 51% must be allocated to people of 25 or of age 25 years and younger. So it's taking that 51% and it's dividing it to another 51%, so half essentially. Another important distinction that I really want to highlight here that's also different from our MHSA days, right, is that we have different type of prevention works that we can engage on as counties. And what I mean by that is that moving forward, counties can only really engage on something the state's calling as indicated prevention, which is the main focus of early intervention. In other words, it's really targeted at-risk prevention services, right? So we need to have some type of pathway to identify people. It can't be the other type of prevention we would do under MHSA, which I've described here below as we call universal prevention. So, which is no longer allowable as a standalone method under the BHSA. For us, right, a universal prevention program would be, as an example, our suicide prevention program, which has been a joint partnership with our public health, right? That would be one of those programs that we will be able to support through BHSA dollars moving forward, since it's classified as a universal prevention system. So here we have a lot that lives under BHSS, and again, page 2 and 3 of your packet goes into detail as to like those dollar figures and where these programs fit. And I'm just listing them here as well, so that way you are aware as well. So we have our early intervention programs, which range from the Hope Center all the way to our HEPI program, to our Latinx Liaison program. We also have programs that were under MHSA Community Services and Supports and now live under here, such as our regional services, older adults program, and crisis residential treatment, also known as Hyperion. Yes, Caleb, go on.
Sorry. So since REST was an innovation program, does it still have the 5-year limit like it used to under MHSA?
Yes, so that's a great question. So I'll get on that in a moment, because actually great timing, we're about to get into innovation anyways, right? So one of the things about innovation is that innovation very much is still alive within the BHSS category. The only problem here is that it crams a lot into one section, right? So for us, REST, as an example, is scheduled to sunset in October of this year as far as innovation dollars go. However, we are still planning on supporting this program through BHSS dollars after it sunsets. Interestingly, it just worked out that everything got redesigned and changed, so then we can continue supporting REST moving forward. Additionally, we have our bucket known as workforce education and training, which again is limited to our workforce staffing. And we essentially use something called the Reliance e-learning platform, which is an online platform for trainings. And also we intend to utilize these dollars for equity trainings as well, such as consultants, to name an example. Additionally, I also want to share with you a couple of things that are not necessarily reflected in the information that I've already shared with you. And that is that throughout this process, we've gotten 2 proposals from community members. One of them is it's called the Early Childhood Treatment Certification. This is actually an initiative that we have supported in the past through MHSA. And it's a proposal that we got through the Nurture Center and one of the directors, her name Beth Haviland. And this proposal is one that both proposals we're actively considering for funding at this time. We just haven't been able to come up with a program description that fits new guidelines and regulations. So right now we're in communication with both of these parties on identifying how it can be formulated to fit current regulations. So again, the first one is the early childhood treatment certification, which is really intended to provide a certification program to strengthen local early childhood behavioral health capacities by training providers to better identify, screen, refer, and link children ages 0 to 5 and their families to appropriate supports. So that's one. And then the other one is a proposal we got from the Humboldt County Office of Education. And this proposal is a 3-year pilot program meant to provide targeted early childhood mental health support for children under 6 who are experiencing significant social, emotional, or behavioral health risks. And they're using something called the pyramid model, training, participation, coaching, and family engagement, and improved referral data tracking. So this program is really aiming to strengthen early intervention capacity, support providers and caregivers, and help young children remain successfully engaged in early learning settings. So again, those are 4 proposals that we have received in the past couple of weeks that I wanted to share with you as ones that we're actively considering for funding. So last but not least, now we're getting into our full service partnership bucket. That's 35% of overall BHSA dollars. And for us here in Humboldt County, we have one program that we call our full service partnership program called our Comprehensive Community Treatment Program, also known as CCT. They are our highest intensity BHSA service for people with severe behavioral health needs, and they are seen as the whatever it takes service delivery. It focuses on individuals at risk of homelessness, hospitalization, or justice involvement. And then I have like a little caveat here about how it differs under BHSA as compared to MHSA. And the biggest couple of takeaway points here is that any housing intervention dollars that they've utilized in the past is now going to be done through the housing bucket that we've described in the beginning. Additionally, there are a couple of SUD mechanisms that are now integrated within the service delivery. More specifically, it incorporates the need to have low barrier access to medication assisted treatment MAT services. And this is going to be accomplished through leveraging local organizations such as Aegis, I believe that's the name. I always mispronounce it. Aegis, thank you. So that's just one of the multiple entities I believe that exist. So there is going to be some channels that they're going to be leveraging for that requirement. And also there's a couple of requirements for evidence-based practices. Thankfully, Humboldt County, due to capacity issues, right, we were able to get an exemption on some of these. However, the biggest one that we still need to uplift is something called high fidelity wraparound services. And that is a really big initiative that really is only focused on youth in essence. So just wanted to kind of highlight that one. So this slide, before we get into like the data piece of our community meetings, really kind of talks about on some of the challenges that I sort of mentioned throughout this presentation. So BHSA, as you've probably seen, is a massive system redesign, right? And it comes with a lot of different changes. One thing that I highlighted is that housing bucket is not necessarily new money, right? It's just a different channel or different way in which counties are now required to use those dollars. In fact, rather than expanding dollars available to counties, the state actually took an additional 5% from counties to fund their own internal processes. So under MHSA, we were at 95% allocation to counties. Under BHSA, we are at 90% allocation. So I just wanted to highlight that it's not new money, and quite literally, it's a reduction of funds in some ways. New requirements do exceed current local capacity, especially for small rural counties. Hence why we had to pursue some exemptions for some of the evidence-based practices that I mentioned for our FSP section. Housing availability, staffing levels, and required services models are all dependent on one another, right? So I know, Bob, you mentioned those changes right at the federal level. So could that have an impact? Not necessarily at the state level, but again, there's intersectionality that could potentially shift or push the state to make an adjustment. Yes.
Just to clarify, is one of the exemptions not to have to follow the assertive community treatment model to fidelity?
So it's a twofold exemption. The first exemption is not having to follow it to fidelity. The other exemption is not not incorporating it in general. Our CCT program, though, one thing I really want to emphasize is our CCT program was adapted out of the ACT model. With the exception of the a 24/7 on-call dynamic that ACT requires as part of its fidelity requirements. So, great question. And again, counties must balance compliance and maintaining essential local services, right? So that's a callback to that early intervention, indicator prevention pivot, where we can't fund certain programs like our suicide prevention program because they fall under the universal prevention paradigm. And also timelines and evolving state guidelines increase implementation challenges. I mean, one of the things that just came up, right, is that this plan is slated to be approved and finalized by July 1st of this year, right? And we're actively still getting guidance in certain elements from the state to this day. So again, I'm gonna now be pivoting to data now regarding our community engagement meetings. During our engagement, which started from December and went all the way till the end of February, we hosted a total of 17 meetings with a total of 159 in-person, or just in total 159 participants attending. Out of those 159 participants, 48, which is roughly 30%, completed a demographic survey. And we also ran a community survey of which only 148 respondents were received. So as far as our community meeting data goes, so for this fiscal year, our attendee region of residents, 38% reported being from the Eureka area, 17% from the Southern Humboldt area, Northern Humboldt constituted 27%, Yellow River Valley was 8%, and 10% did not answer the question in the survey. So this is a comparison of who submitted a demographic survey as compared to the general population of Humboldt County. As you will see here for African Americans, Black and Asian Pacific Islander, we didn't have people who identified as either during the demographic survey. However, when it came to multiracial/other, we have 16% that checked that box. Additionally, for Native American populations, we have 9% as compared to 5% of the general population. And then for Hispanic/Latino, we had 19% as compared to 14% of the general population. So as far as attendee gender, 67% identified as female, 27% identified as male, 2% identified as two-spirit, and then 4% prefer not to answer the question. As for attendee age, we had 11% be from the age range of 16 to 25. 60% is from 26 to 59. As for 27% were 60 plus, and 2% preferred not to answer. As for community members with lived experience, 29% reported being diagnosed with an SMI. 67% reported being a family member who has an SMI, and 71% responded as being a friend of somebody who has a SMI. Yes, Vernon.
Can you back up one?
Yeah, of course.
Please, I'll follow
This
it.
one.
Yes, sir. You're saying that 27% are 60 and plus years of age. Are you finding that age range are growing?
Yeah,
The older population?
Yeah, great question. I feel like just comparing other numbers and seeing how we've engaged with other populations, that's a fairly consistent rate that we've been noticing.
Okay.
Because we're usually ranging between 20 and 30%.
Okay.
We've been noticing. Yeah.
Thank you.
Yeah, no, great question. So then, as far as percentage of community members who identify as a member of a special population, 27% identify as LGBTQ, 4% as veteran, 29% as involved in with CWS, 40% experience homelessness, and 42% as justice involved. And one of the things that we learned as well is that we received a lot of comments through our process, either verbally or written, by phone and by email. So what we did is we took a ranking of themes that came across comments, with the top three really being comments regarding PHSA implementation, increased support for youth, and in addition, expanding or increasing access to services. So again, those are like the top three themes that kind of came up as we met with people throughout our community. Now, as far as our community survey data goes, we have a total of 148 responses. Out of the respondents, 15% reported that it was not their first time responding to the survey. 84% responded that it was their first time responding to our community survey.
wow.
So one of the things that we've noticed is that over time, we've actually been seeing a steady decline of respondents we get from our community survey. And we feel that largely it's because people who are new to the survey are the ones who are more prone to respond to it seems. At least it's kind of what I'm thinking it might be the case, given the data or this metric that we received this year. So from the people who responded to the survey, 2 were out of county, 5 preferred not to answer, 9 were from the eastern region of Humboldt, 10 were from the southern region, 18 from the Ill River Valley, 44 from the northern region, and 60 were from the Eureka area.
I noticed in the previous data, I think it was the in-person meetings, there wasn't any from Eastern region. What did I?
There were a couple of meetings that we hosted, but we did not get people that joined that meeting space. Yeah.
Wow.
So if you have any recommendations in terms of like who I can reach out to moving forward and such, I'm more than happy to coordinate that one with you. But yeah, we were not lucky. There were years where we have gotten some engagement from the region, but this year we did not.
I would love to work with you.
Yeah, absolutely. I'll definitely reach out to both of you afterwards too, and try and coordinate that for this upcoming year's input as well.
I have some ideas too, just add me to that list if you wouldn't
Yeah,
mind.
I'll-
Thanks.
Definitely, I'll make that note right now, so I don't forget.
Relationship issue, I think. Anybody know that?
Perfect.
Regional services.
Okay.
Did we use any social media?
What's that?
Did we use any? Okay.
Yeah, our DHHS media team helped me do several news blasts across the county, including social media. So as far as respondent age range goes for our community survey, we had about 1% in the 0 to 15. I always kind of chuckle when I see 0 to 15 because I just picture a baby filling in our survey. 9% were 16 to 25. 72% were from 26 to 59. 14% were 60 plus, and then 1% were 75 plus, with 3% preferring not to answer the question. As far as gender identity goes, 1% identify as being another gender identity, 78% ended up being identifying as female, 1% as genderqueer, 13% as male. In the purple here, 6% people prefer not to answer, and then 1% is transgender. So as far as race and ethnicity goes, here we have a breakdown. 3% identified as African American / Black. 16% as American Indian / Alaskan Native. 3% as Asian Pacific Islander. 47% as white. 13% as Hispanic or Latinx. 5% as multiracial. And then 11% prefer not to answer, and then 2% as other. So as far as additional comments, we asked on our survey for additional comments, and what we see here is a ranking of themes that we received through these comments, with the top 3 being increase to behavioral health services in general, and improvement of access to services, and increased staffing and recruitment. So as far as these top themes go, I wanted to also give you descriptors of them as well, just to kind of add a little bit of additional context. So as far as comments regarding VHSA implementation, many meetings included questions, frustrations, and concerns regarding VHSA implementation, including prevention changes, kind of as we mentioned that from universal to indicated, funding restructuring, increased state requirements. Some folks expressed a concern of a loss in local flexibility due to these new requirements. housing mandates, evidence-based practice requirements, and confusion around timelines and guidance, just because some participants were really savvy, were hearing contradicting information from other avenues across the state. The other thing that we had here was an increased support for youth. So many meetings emphasize the need for expanded youth-focused behavioral health services, especially for vulnerable and underserved populations. Community partners discussed increased support for children, adolescents, neurodivergent youth, free support services, and youth-centered prevention and intervention programs. I mean, two of the proposals that I shared with you today were really largely centered around youth services as well, as an example. Yes.
What is neurodivergent youth?
Yeah, so those are people who, for instance, are like in the autism spectrum, as an example, have a brain injury as well. That's just to name a few, as an example.
Thank you.
And I believe that you were one of the people that highlighted that in our last meeting too, right? So, yeah, so that's one of those comments that we received. The other one is an expand or increase to access to services. So community members consistently express concerns regarding difficulty accessing behavioral health services, including long wait times, delayed response times, limited regional availability. So that's where the services are located, right? Because a lot of them, as they express, were located in the Eureka area. Insufficient coordination, such as not enough warm handoffs, as an example, and barriers navigating systems of care. Participants recommended expanding service capacity, outreach, navigation support, and regional service availability. Additionally, there was a theme of workforce support that came up a few times. Multiple groups highlighted staffing shortages, recruitment and retention challenges, and the need for better compensation and training. Requests included additional peer supports, bilingual clinicians, enhanced care managers, crisis intervention training, and specialized workforce development. And then I believe this was actually the last one, and this is housing and services for those experiencing homelessness. So that's housing instability and homelessness were major themes across regional meetings. Community partners discussed limited housing availability, lack of interim housing, difficulties navigating housing systems, coordination barriers, and the need for strong long-term housing solutions and supportive services. So again, those were really like the 5 core themes. I just wanted to kind of give you a breakdown of, just because we got a lot of substantive comments around them. As far as next steps go for our planning, so input from today's meeting will be added to our report for 2026-2029 integrated plan. Based on that reporting and those comments that may come up in today's meeting, we may make additional changes to our plan. And then lastly, our plan is slated to go to the Board of Supervisors June 16th, which is like right around the corner. So once we do that and we get finalized approval, it will be submitted to the Department of Healthcare Services and to the Behavioral Health Service Oversight and Accountability Commission for full implementation of the plan and its budget. So, and here's just kind of like, I call it like our DHSA journey, right? The series of steps and dates that we went through to really get the plan to where it is today. With, again, us being in our May public health hearing meeting, and then June 2026, having that plan go to DOS for approval. So again, that concludes my presentation for today. And I'll open the floor for any comments or any other input you guys may have in mind. Thank you for today.
Thank you.
I guess I just had a pretty general question. I'm not sure if you included it somewhere, unfortunately, but I saw that the state treasury was going to be responsible for allocating funds to each individual county, correct?
Yes.
And is there going to be any sort of oversight or new organization that are going to be like distributing and using the funds responsibly throughout Humboldt? Because a lot of the times, like right now with some of the HUD grants that we receive, it's not directly through the county services, like county behavioral health, that we're able to implement the funding, but through like our local nonprofits, like Raven Project, we'll be able to take on some of the funding to build the housing units that are in the process. But yeah, that's it, is just how our funds going to be distributed and used responsibly.
Yeah, great question. So for us here, the funds that I talked about specifically are funds that get distributed directly to Humboldt County, right? So, and those are managed by our fiscal team here in the HHS. Essentially though, one really important distinction that I really want to make about this plan is that the plan itself talks more about how we intend to use the dollars, right? This is us communicating to the state, this is how we're gonna be using dollars moving forward. However, it doesn't talk about outcomes or anything of that nature, right? And there is gonna be future reporting that's gonna go live, we're gonna have to be managing behind the scenes that talks on what happened with those dollars ultimately. Which kind of talked a little bit about kind of what the point that you were kind of thinking that, about, again, reporting what happens with these dollars, how were they used, and what were the outcomes.
Thank you.
Alfred, being that the big change was that it wasn't just gonna fund mental health stuff, but also substance use disorder stuff. Did you feel in general, as you went around to the community meetings, that there was pretty good representation of people expressing their substance use disorder concerns?
Yeah, great question. And yes, we actually, that was something that came up, not as frequently as other themes that I mentioned in the conversation, but it did come up in several settings. I know we did attend a meeting where the SUD work group meeting as an example, but that did also come up by other members of the public and even in the community survey as well.
Okay.
Okay.
When you have like the 3-year plan, like, what is like the requirements, like to the fidelity to the plan, or like as needs shift going along, what is like the possibility of changing the desired allocation?
Yeah, that's a good question. So there is some kind of flexibility to change the allocations. So like, for instance, those buckets like that 30%, 35 and 35, counties do have the flexibility of adjusting some of that if they can or want to. The issue here is that once this integrated plan passes, it becomes locked for 3 years. So those buckets absolutely become locked and we can't touch them until the next integrated plan goes live.
And that will be 3 years from July 1st.
Right.
How does this plan impact the availability of peer support?
Yeah, great question. So it doesn't change the availability per se of peer support. What it changes though is the focus, right? So for instance, we've had programs within early intervention or under MHSA where some of the peer support was seen more as universal, right? So more like widespread. And it's that now we have to pivot to more of indicated prevention at risk, right? So in the sense of like the scope, right, it's gonna be a little bit more narrow. But as far as our actual peer support staffing and all of that and budgetarily, that has not necessarily been changed.
So do you mean it would be more clinical or more like case management?
That's a good way to describe it. I think it'd be more focused or more targeted. So
Individualized.
yeah, more individualized, exactly. Which honestly, our peer support for the most part has been already, I feel. It's just more about certain activities, certain programs may or may not have been doing in the past, such as community-wide events.
And whether or not we have peer support as a service available isn't contingent on this funding. Like, we have that service anyway, and this is something that in some places can supplement or support that work.
Thank you.
Any other questions?
Just one more about the language. It was universal framework versus implemented framework?
Indicated.
Indicated, okay,
Yeah.
thank you.
Yeah, or how I like to say at risk.
Okay.
Can I just ask, because I go to the Pal BHP meetings, we seem like we're meeting our deadlines, fulfilling all the requirements. There are many counties that it appears are not doing that. What happens if you don't?
So ultimately, what would happen is we wouldn't be able to touch dollars until we have an approved plan. So that would be the biggest consequence of not having a timely approved plan.
So once again, I'm gonna say Humboldt County is rocking it. Go team. All right.
wanna point that
And-
out.
And I do wanna say before we end, this plan has taken the effort and a lot of different people who are not present today. Ranging from, our core leadership team, and we, the deputies, Connie Bag. Some people who honestly are new to my team or communication, such as our DHHS, housing experts, right? Public health, child welfare services, Raul Torres from the home department. It's been a huge lift to our finances team, our fiscal team, like at Sordo Home as an example. That budget is an absolute beast, and the fact that she's able to do what she does is nothing short of magical. Honestly, it really is amazing. So I just wanted to give them a special shout out because again, a lot has been happening behind the scenes to get this to the finish line.
I just want to congratulate you, Oliver, in the years you've been in this role. I think you've done an excellent job at really like trying to get as much input from the community and building it in. I appreciated you having like the summarized like biggest concerns and that's hard to hear sometimes, especially when we don't have the capacity to do the things that the community wants. And I just wanna, I wrote it on my form and I already asked about it. I just wanna say, I really think it's important that administration looks into why Eastern Humboldt's not showing up to meetings and how we can do better at building relationships, especially with tribes, not just in Eastern Humboldt, but throughout the county. We have programs that serve Eastern Humboldt and I'm wondering why their managers aren't, building relationships or attending community meetings and having that buy-in. I just wanted to name that, as it's nothing to do with you, but, yeah.
Yeah, and I wanted to say that at the beginning of this whole thing, when it, went from MHSA to BHSA. I thought, oh gosh, look what's happening. We're gonna be robbing Peter to pay Paul. We're gonna, yay, because I'm a SUD person, we get more for SUD. But what a crummy way to have to do it. But I really see that through all the work and all the feedback and everything, we haven't had to lose too much and things are reworked. And there will be a really positive gain and some recognition that, both sides of the coin are gonna, be further helped than they were before. So, I'm quite frankly relieved about that because the initial way it was all presented sounded kind of dismal.
Yeah.
And, because there isn't additional funding.
Yeah.
So, unless we get more millionaires.
Right.
Let's have everybody make more money.
But
anyway,
gone.
And
it's a great job that you and the whole team have done.
And I gotta say, kind of to what Laura kind of mentioned a moment ago, is other counties have had different experiences. Right, certain counties have had to terminate programs, some of them had severe budget cuts as well, right? And here in Humboldt County, we didn't experience as much of it, although we did experience it to some degree, such as our suicide prevention. So yeah, thank you for the comment, that's really kind.
Have we submitted or looked at the public comments that were written?
Yeah.
Submitted a proposal, public vendor's office for it.
Yeah, actually, I saw it this morning, actually, and I'll do admit, I haven't seen it fully thoroughly just yet. However, there were a couple of elements that I would like to talk to you about, actually. Predominantly, the proposal that we received, right, it seems that it focused on the staffing of 4 attorneys and 4 social workers, correct? And that we're flagging that right now just because it's not necessarily tied to behavioral health services as it's intended for BHSA. BHSA, at one point I really want to emphasize here is that BHSA can prioritize justice involved individuals. But that does not make legal representation, court advocacy, or public defense operations necessarily allowable under BHSA costs. So I just wanted to really highlight that distinction.
I think multiple other counties have done the exact same thing and have used these funds for that.
Yeah, and I would like to talk to you more about that for sure. Just based on what I've seen, right, and what I read, maybe that's in speaking to you, maybe that's gonna be something different, right, or in my interpretation.
Yeah.
But yeah, absolutely, I did receive it and I do have it, and I actually made a couple of notes about it too here too, so yeah,
And if you have questions about it, yeah.
Yeah, absolutely. I will definitely be reaching out to you between today and tomorrow with more questions around it.
All right.
No questions?
Oh,
Very cool.
Going, going, going.
Thank you so much, Eric.
Thank you all.
Appreciate it.
Great job. All righty, moving on, communications. Natalie, let's start with you.
Thank you. Full disclosure, I did ask to go first because I had to go to a ribbon cutting for something. Unfortunately, I'm about to leave in a few minutes, but I did have a chance to go to Sacramento for a conference, a legislative conference, really focused on the state budget revise the governor put forward and some of the ongoing negotiations that the Assembly and Senate will be engaging in. And as the county's representative to this like state association, I got to go and meet with legislators who are the chairs of the budget committees. And you know, the governor's executive secretary who really has like the governor's ear. So it was good to have the chance to advocate for some of the requests that the California County Supervisors Association and the Welfare Directors Association are jointly putting forward around a response to HR1 or the big beautiful bill. And the impact that's going to have on health and human services and behavioral health services. So our deputy CAO, Sean Quincy, who it looks like is on the Zoom, put together a really great letter, and I reached out to our assembly member and senator respectively to just emphasize how important this is. And it is a just under $2 billion ask, which in the scale of the state budget is actually like a pretty small amount. It's a huge amount to counties who are, you know, the frontline service providers to so many folks in our communities. So I wanted to see, it's not on the agenda, but I wanted to see if there was interest in having this sent out with some talking points about what those asks are, and if anyone has the interest and willingness to reach out to, I can include, you know, Senator McGuire and Assemblymember Rogers' email addresses in there. It doesn't hurt to, now is kind of the time, like this next couple of weeks is when they're really doing a lot of negotiation around the budget. And it's been a little bit of like playing hardball, sounds like. So the things that are really high kind of highlights of that are that there's going to be a huge drop in a lot of people dropping off Medi-Cal because of this, and then a huge increase in the cost for indigent care, which counties are required to provide, and there's not really a good framework on how we're going to do that. And then quite a bit of additional eligibility work, so additional funding for eligibility workers to make sure people can get Medi-Cal and HealthFresh and essential resources, which we all know affects people's mental and behavioral health outcomes. Some funding directly for county behavioral health departments to increase services outside of what's allocated in the VHSA, and so it fits nicely with what we just talked about. And then funding for public hospital systems in California. So it's a pretty big need, and I'm really hopeful that over the next couple of weeks we'll get to a better place with, you know, some meeting in the middle around this. But I think it's safe to say that, you know, it was a very it was a pretty hard conference to be at, where we're all talking about, you know, especially the counties that are more rural than us are in deep doo-doo. And we're all really struggling to keep people, you know, even recognizing that our systems aren't perfect as they are, they're going to be severely impacted this next year. So it was, honestly, it's kind of a hard time for, you know, I think I imagine all of the staff and those of us in all of these kind of leadership roles and trying to figure out how to just stretch dollars even further. And there's going to be just this huge kind of amount of funding that is needed. So happy to send that to Laura, and then maybe we can send that out to you all. And I know Sean's on here. Sean, I assume that's okay with you. We just go ahead and invite, who would like to kind of echo those asks, to be part of it. I apologize for not asking to put this on the agenda, but I just sort of came back from the conference last week. It was like really motivated to, ask for community voices to kind of step up on this. So, that's all I have, and I'll make sure to send it to you, right after this, and, sorry for having to leave a little bit early.
It's okay, thank you. Thanks for going through that meeting.
It's really dark time. But we really are all in it together, so, thanks.
Thank you, Melanie. Vernon, do you have any communication?
No.
He actually does, but he'll chip in when we're not talking. So, Brennan and I, have been on a, ad hoc committee of the board looking at legislation. So first thing, I wanted to thank the board. Last month, you put out to pass on to the Board of Supervisors the thing about, nitrous oxide, which basically was endorsing the bill that was put forward to include the fact that online sales for minors should not be able to happen. And I appreciate that the board voted on that to put it forward to the Board of Supervisors. So we have one other meeting that Vernon and I went to with Nancy Stark and Sharon. And at that one, the one I'll talk about is I think it's SB 490. And basically, that's a kind of a weird little piece of legislation that applies much more to Southern California than to us up here. But it's in terms of why they did it. But evidently, it's particularly in what they call the rehab Riviera of Southern California, which is kind of Orange County and Malibu, all that, you know. There have been a number of transitional living programs and sober living programs who had the audacity without being licensed to offer treatment, which is a big no-no. So the state obviously has to investigate that and will be investigating that, but the bill had one sentence in it that counties don't like. And that was that if the state, there were some deadlines of when these investigations have to happen and all that, how quickly. And there was one line that said, if the state feels that they can't, meet the timeframes, they can ask the counties to do it. Well, all 58 county alcohol and drug administrators said, no. Mostly because they don't have jurisdiction over any of those programs because counties don't contract with them. So, but the interesting thing is the entire legislature has said, yes, let's do this, not really thinking about what that one sentence has. So when we went to the meeting, Nancy and Sharon said, well, maybe this doesn't really have to go forward to our Board of Supervisors in that it isn't so applicable to us right now. But at least we wanted to raise consciousness that things like this are happening in the state, and we wouldn't want to be in Humboldt County either. So that's kind of how that one went. And then Vernon, who said he had nothing to report, really does, because he's been looking at peer support and peer employment kind of bills that are coming forward. So I'm going to hand it back to him.
Good. Thank you. I am looking at Assembly Bill 2138, which is the California Assembly Bill introduced by Assemblymember Maggie Curl. The 25-26 legislation session seeks to expand the role of peer support specialists in Medi-Cal Enhanced Care Management Program. I have made a copy of 15 copies that are sitting here. That the date of the hearing was May 13th, 2026. At the Policy Committee of Health, there was 15 for one vote. in approval of it. I am going to be asking this board to take a closer look at this. I am asking all of our peer coaches and peer support specialists to take a look at this. I'm getting letters of support from our staff of peer support specialists and peer coaches that they are in approval of this. So hopefully at the next board meeting, I will be presenting those letters and asking this board to go to the Board of Supervisors and ask for a letter of support.
Bernie, feel free to reach out to me.
Follow up more.
Okay, thank you.
Thank you. We have one more meeting to that ad hoc committee to kind of wrap things up. The date hasn't been set yet. I think it'll be in July, really after the, budget's passed. Or proposed.
All right, thanks. Bob, do you have anything?
I'm the voice of the veterans, that's my wheelhouse, and last month I reported that I did a 4-hour orientation and a live scan for Wild Souls. I volunteered my services for an upcoming equine program for veterans. In this last month, they bought another ranch in Arcata. So that will be upcoming. That program is through the Vet Center, a collaboration between Wild Souls, Vet Center. So that'll be upcoming. So and the other thing, just for a reminder, in Nation's Finest, we have a transitional housing program for at 30 beds. We offer SSVS, supporting services for veterans families services that includes rent, deposits, for people who are both housed and are housed. And we have, also under our umbrella, we have CalAIM. So we have a plethora. Oliver used that word, I like it. Services available to, the different aspects of the community, not only just veterans, but we also serve the non-veteran community here at Nation's Finest. So, a vet who's fallen on some hard times and needs some help, get a hold of me or Saul. Thank you.
Thank you for serving on that.
Danette. Do you have anything?
No. I went to a event at California a couple weeks ago. And they're quite interested in coming and doing it for our community, the board or whatever. And I was quite overwhelmed with watching it because it made me realize how much we set our people up a lot of times for failure. Because we have unrealistic expectations for them to do it in our timeline and not in the timeline that our clients have or our people have. Anyways, they would like to, I talked to the teacher that put it on, it basically, has anyone been to the?
Is it breaking the cycle?
It is breaking the cycle. And so I've already got them, they want to do it. I believe we may have a place to do it at. And so I want to, talk to you guys about doing it. I think it's important for our community, probation, parole, people that work for mental health, people that are case managers, social workers, whatever, to, watch or to be a part of this, to see how we have these we have expectations that are not measurable to the client's behavior or client's lifestyle. And so I'm hoping we can talk a little bit about that.
Can you send me an email?
Absolutely.
Awesome.
Absolutely.
Miss Perkins is the best professor I've ever had, so any work we can do with her, yeah.
It was overwhelming to watch, because they set up all, in a big room, they set up all the tables of
you know, like social, birth certificates and DMV and probation and, food stamps and all that stuff. And then they have files for each person. First of all, you don't get your name, which I was like, no, I'm not doing that. Cause you know, you can go to jail for not using your name anyways. And so they have files for everybody that comes to the event with anonymous names on it, and you get this file and it gives you a little bit of money, fake money, of course, monopoly money. And you have all these things that you have to do in a certain amount of time. And if you don't get it done, you gotta go to jail, and there's a little jail. Anyways, it's really a beautiful event. And I think as people that work in a community with with people that have a lot of barriers themselves for thought processing and stuff. I think that it was overwhelming and it could benefit many of us who work in the field that have unrealistic expectations from people to get things done in art and, you know, in the amount of time that it takes us, basically. And so, yeah. I have the card. I will send you an email. That's fine. Thank you. Other than that, I'm sorry, one more thing. The Recovery Happens is going to be September 19th. We are voting this next, it would be next Wednesday. We are voting on whether it's going to be at Bear River or Sequoia Park this year. We have two spots, and then we're thinking if we have it at Sequoia, we might have it 2 different times. So I just want to share that if you want to be a part of the decision making for Recovery Happens in Humboldt, I believe this is our 10th year of doing it. Last year there was over 700 people there. Wow. And so please send me your email so I can put you on the Zoom. Thank you.
All right, before I go to Sean, did you have a quick question?
I just want to say thank you to this board and the county staff for making my dream come true of tabling at events over the last couple of years. I will not be able to do that this year because of the fact of moving to McKinleyville, but I do want to especially thank Connie Beck, Amy Rogers, and this board specifically of backing and supporting me in that and obtaining the materials. So I just want to say thank you, county staff, and thank you to this board.
Thank you.
Sean, you know, anything, but if I passed over you, it'd be sad.
No.
Jess, do you have anything, communication?
Yeah, I just have 2 little events that I want to get out there. They're both put on by Queer Humboldt. The first one is Queer Relationship Skills Group. It's happening July 6th through July 27th. It's on Zoom. You can find it on their Instagram, or you can email Michaela at queerhumboldt.org. And then there's also the 5th annual Reverend Coach Two-Spirit Conference, October 17th, 2026. It's a little bit down the line, but it's an extremely important and sacred moment for people to come together, and everybody could use an opportunity.
Thank you. That's it. Thanks, Justin. Peter.
Keep it short, I got a couple of things, Jeremy's on the line as well, but what Danette was talking about, we were doing some integration work, and we were down in Inland Empire, your folks from agency folks, and we did something similar called In Their Shoes. And it was profound, and to build that empathy and to have that experience and to draw those parallels, I think is really wonderful. So we've been talking about, I'd love to connect on what you did and talk what we did, but we think that'd be really good to offer that in Humboldt County for more people. We're with the Humboldt County Office of Education is putting on a Cultivating Belonging conference, which is happening on June 15th and 16th. and, which is an exciting third annual. A lot of the materials are based in improvement science and compassionate systems awareness, so that will be happening, and then there's a youth track that's part of that experience that happens on the 15th, and currently there are still seats available for youth and ages. I mean, the target age is really students from 9th to 12th grade. But anybody in the county who's interested in doing that could do that. You can register on the Humboldt County Office of Education's website. So if you need that information, feel free to contact me or just contact HCOE and find out. That'd be great to get some more youth. My daughter's gonna. But anyway, so that's exciting. The other thing is we're moving forward to replace 2 positions for our certified wellness coaches, one who will be working specifically with our team around foster homeless, and then another who will be serving Fuel River Valley in partnership with Humboldt Bridges to Wellness. So I'm excited that we're able to hire in. Natalie had highlighted such a challenging time financially. But we are working towards sustainability of those positions through the state multi-payer fee schedule. So hoping to move forward with that vision. So anyway, just filling in on those things.
Thanks, Peter.
Yeah.
Bill Johnson. 2 things. I just want to piggyback on what Jess was saying about Queer Humboldt. They have a lot of really amazing culturally responsive behavioral health groups, individual counseling and community events that serve folks from the LGBTQIA+ community. I probably botched the acronym because it's always changing. And they have a mailing list. So what I just sign up because I have a few veterans I work with that are part of the queer community. So I'm always trying to link them to things that are maybe a little more culturally responsive than what's available through veteran services. But they send you a monthly newsletter with all the different groups and activities. So just putting that out there for service providers or folks that are interested. So thanks, Jess, for mentioning that. And then Laura Montagna, she led on behalf of Eureka Police Department a crisis intervention team training last week. And she had an auditor from Post auditing her course all week long, which
You never had.
I never had all the years I did it.
Nor did the county.
And she passed. And so I just want to give her big props. The legend.
All right, that's my turn now. Thank you, Kelly. I wanted to report on our CIT 40-hour training, which just happened, crisis intervention team training, which I'm so grateful for NAMI Humboldt, EPD, Blue Lake Tribal, Humboldt County Sheriff's Office, DHHS, what I love about it is that all these different groups come together, and it's what I love about Humboldt. When we work together, we do better. So it was awesome training with half of the attendees, 27 were law enforcement officers and half were social workers. And we had a big group come from Humboldt, which is legendary. So when people, this is what I've learned, keep showing up and asking, because you never know when that one person is gonna go, oh, hey, yeah, and trying to reach out to different agencies. So that's my lesson from it. I'm so proud of our county. I'm so proud of all of us who are doing this work, and just keep it up. That's it from me. Thank you all. Director or Deputy Behavioral Health Director. You're up.
All right. Sounds good. Thanks, everybody. I do think you're a rock star, Laura.
Thank you.
Let's see, I have a couple things. I was glad that Natalie was talking about some of the HR1 challenges and efforts around that. And it is impactful to behavioral health, obviously, and still a bit to be determined, just because that we'll get a better sense of where we're really having shortfalls or where we're really having impacts to compliance and eligibility on Medi-Cal and other things. But one of the things I wanted to mention, kind of related to that, is that we're right now working, public health and behavioral health branch together are working on coordinating some community reinvestment funding use through Partnership Health. So counties, Partnership Health, health plans throughout the state are being required to reinvest money into the communities based on their own revenue that they're generating. And so for Humboldt and all counties throughout the state, we're just looking at the categories that we're allowed to use that reinvestment that aligns with both behavioral health initiatives, but also very specifically with some of the public health initiatives, the CHIP and the CHOT, and some of the things that are flagged in there for community priorities.
CHIP and CHOT.
No, I can't say what
Okay.
those are.
Community health
Yeah,
improvement plan-
somebody else is gonna say that.
Community health improvement
Yes.
plan and the community health assessment.
Yes,
Thank you.
that's right. Thank you. I do know them, but not on the spot.
Sorry,
Yeah.
it was her fault. She asked me and I.
That's okay. That's okay. Thank you for asking. Thank you for answering. But so we're just at a kind of preliminary state where we kind of decided the areas that we want to propose that we reinvest locally, and it will have to be approved. But two of the places that we're thinking about doing this is related to Medi-Cal eligibility, so funding local organizations or groups, including we're asking HCTC for a proposal to look at how can we support our community people eligible and on Medi-Cal, because that's so critical to be able to continue to get services. And the other area we're looking at is investing some of the funds into continuing the DMC ODS model, which is in transition and also a super critical area for our community to be able to continue SUD services. So none of that has been finalized or approved, but those are kind of the areas that we're talking at this point about wanting to be able to use resources to continue access and care in our community. So more to come on that. I'll definitely update this group. The other, let's see. One of the other things I was just gonna mention, and I can't remember if I already shared with this group, and maybe I did, so sorry if I'm repeating myself, but starting July 1, within behavioral health, we're having some shifts to just what falls within behavioral health branch. So APS, IHSS, and Veterans Services, which have historically for the past several years been under the purview of behavioral health, are now moving back under social services, which I think is a really good thing. The budget has remained under social services, but it just in some ways kind of cleans it up. Our effort will be around continuing to have good coordination of care and integration between those adult system of care programs and behavioral health, because often many people cross over. The one area that is going to remain under behavioral health is public guardian. And so that will continue under behavioral health and will actually be moved more fully underneath us in terms of budget as well. So just kind of cleaning up a little bit. And a broader piece that maybe is less pertinent to this group, but I'll just say, because it's a change within DHHS, is that several years back, the social services director was separated out and placed only under child welfare. So having a child welfare services director, and then Connie took the role of social services director. They're undoing that. And so that position will now move back to social services director. And that's part of the movement of some of those other programs that are girl health, the social services.
So it was APS and what else?
IHSS and Veterans Services. Yeah. So anyway, I know that's maybe a bit in the weeds, but I just wanted to share. And then the last thing I'll just say, kind of in response to your comment, Kelly, about relationships with tribes, I appreciate you lifting that. I think maybe you're not aware of all the things we're doing, and I'd happily have more conversation about that, but it is certainly an important area that we focus on and talk a lot about internally. And so just want to acknowledge the importance of it and just say, I think there is some pretty good work we're doing and would be happy to have more conversation around that at some point. That's it.
Thank you. Paul, Vernon has a question, real quick. Is it a quick?
And yes, the new May Revise is out. Can you tell me as a whole, what that looks like, here in Humboldt County? And as programs, can you tell me if,
Yeah, that's a huge question.
okay,
But we should definitely get some support in maybe giving some bite-sized information
okay,
about it. I don't think I could do a
Okay.
good job right now.
all right, thank you.
Sure.
Thank you.
All right, Paul, you're.
Yeah, CIT was this past week and I'm really happy that Megan Sheeran was awarded the CIT Responder of the Year award. So that is a big accomplishment for her. And I think that was awesome, well deserved. And thank you for doing such a great job on that tree. So thank you for that. Our county continues to get a lot of attention related to the CARE Act implementation. Humboldt County has been asked to participate in a RAND in-depth review. So Department of Healthcare Services awarded RAND this award to do a qualitative review of CARE Act throughout the states. They're picking 12 counties and Humboldt's one of those. So that that's happening, and Mr. Brownfield will be a part of that, as well as our other justice partners and our care team. So that's happening. We have over 50 petitions filed, with CARE so far. So things are, and with no signs of those petitions easing up at all. They're just continuing to come in. A lot of them from our justice partners. WellPath has taken over the behavioral health services in the correctional facility as of May 1st. So we've been doing a lot of collaboration with them, making that transition go smoothly. And we're continuing to meet on a weekly basis to ensure that transition is going smoothly, and it is going smoothly. So we're happy about that, and I'm glad that they're almost fully staffed now to provide services in the jail. So really happy for them to provide those important services to folks that are incarcerated. Our MISS team is continuing to grow. We've are starting 2 new peer coaches this week, and I've got another one, 2 more in the hiring process. So we're excited about that. Our collaborations with the Humboldt County Sheriff's Office have been going wonderfully. We have officers, deputies that come and join our meeting monthly, as well as Arcata PD. So we had Arcata PD join our meetings as well. We're doing a lot of collaboration with the city up there. So that's been going nice. And also the collaboration with the care team, City of Riga's care team. They're up and running with their team as a contractor for us to provide mobile crisis benefit services in the Eureka area. So that's going really well. I did want to mention, we do have a few collaborations with our tribal partners happening, coming up next month. We're partnering with Kamau to provide some mobile crisis training up in Hoopa, and that'll be the end of June. So we're excited about that collaboration, and we're also collaborating with UIHS and tribal convenings happening this next month as well. Beginning of the month. So that is going to be about crisis services. So a lot happening, like Emmy has mentioned, we're really focusing in a lot there, and there's a lot of activities happening. So they're really good. That's it for my programs.
Thank you. Jeremy, got anything for us?
Let's see, on the children's side, I was talking with some staff, and right now it's kind of the busy season for a lot of things that aren't necessarily super exciting, but they're really important. We're in the middle of updating a lot of our contracts and getting those finalized for the new fiscal year. We have some site certifications going on for the Humboldt Plaza site and for the our Fortuna site. So we're updating a lot of policies and procedures and site manuals and again, things that are kind of in the background, but are important to kind of keep our day-to-day services going. So we have staff busy with those things. Let's see, continuing work around some of the mandated evidence-based practices. Oliver mentioned earlier high fidelity wraparound. So that's a pretty large project for us to try to understand some new billing rates and guidance that the state is still forthcoming, and working with our contracted providers on their certification process to get ready for the rollout of this high fidelity wraparound service. Let's see, and then I think one other thing that was on my radar is that every year the state does require us to have a couple of different performance improvement projects going. Usually it's a clinical one and then a non-clinical one. And so we're in the intervention stages of those projects. The first one is where we're focused on ensuring that we are following up with both adults and children that present at our emergency departments with a mental health crisis, and making sure that they get mental health follow-up within 7 days of being discharged from the hospital. So that's a project we're working with Providence to make sure that we're being notified of all those patients and that they get a timely follow-up. And then for our non-clinical PIP, what we're working on is expanding our peer certified peer support services. And so a couple different things that we're doing to try to increase the number of peers that we have employed, and as well as increasing the billable services that they're offering so that we can continue to expand peer support services. So those are a couple of the improvement projects that are right now they're in the middle stages of implementation and evaluation. So we're excited that both of those things are moving forward. So I think those are the big things on the children's side.
Excellent. Sounds like great work, Jeremy. Thank you. So Jack, are you there?
Yes, I am. Hi.
Hi.
Hi. Yeah, thanks. I just maybe have a couple things. The first, I just want to acknowledge we're in the kind of waning days here of May is Mental Health Awareness Month. I want to give a very positive feedback to one of our peers over there at the Hope Center, Rhonda Oath, who really stepped up in light of some staffing challenges there this month and really coordinated everything. And I think we had a successful walk there to the courthouse and our barbecue on Friday. Unfortunately, because of my schedule and some of the commitments with mobile response team, I wasn't as hands-on as I've been the last few years, and she really did a phenomenal job for us there. And so that was great to see, and appreciate her and the whole team over there at Hope Center, who really, I think, a lot of the folks there kind of knew this is their first go around with all of the festivities, and they really put their heart and soul into making this effort worthwhile and noticeable. And so I really appreciate them over there. In terms of stuff that's going on, we're getting close to graduation, or we're there. All of our interns from Cal Poly have wrapped up their time, and we're looking forward to seeing some of the fruit of those efforts to give them a valuable internship and get them excited about working for the county. And so we're hopeful that will translate into some applications, some submitted applications for a clinician for us. And then, you know, contract season is here. I've been spending time on a lot of our long-term care facilities, those contracts, making sure they are either amended or going to the board of supervisors. And that, you know, is a pretty heavy lift. We have a lot of those facilities, you know, some here locally, Crestwood and Lighthouse and TRTF, and then just a whole slew of them, you know, out of county, which I know I've talked to this board about on a few occasions. So we need to, those are all sort of July 1st deadlines. And so we're working hard to make sure that's happening and there's no disruption in those placements for our folks who need long-term care. So those are my updates.
That's it, huh? That's all you're doing, Jenna? Good job. That was a joke. All right, well, we are getting close to our time. SUD committee, do you have a?
Yeah, I do.
Awesome.
So we had this past, committee meeting, we had, Recovery Connection, sorry, I wrote it down. Recovery Connections, which is the ECM, service that's in this area, come and present. You know, as much as, we'd like to think that, it's all inclusive, there's also, there's these wonderful people that, that step in and they have some services that are, sometimes easier or another way to get to, our people that need help. Sorry, I had too much Starbucks. That didn't come out right, but anyways. I usually let people know before I drink it. Anyways, so anyways, they came out, they did a presentation. They have a little program over here on 3rd Street. They have a different, ability to meet with, some of our people out on the streets and, in communities. And so, they were pretty awesome. If you guys, want information, I can send out the phone number. You guys can call and enhanced care management is what they do. So, what else? We seem to be short on a chair, a co-chair for that meeting. So I'm just gonna say it out loud, cause I have some, in July, I have some, an outing to go to, and so, if we could have somebody be there for that day, I would appreciate it.
All right, can hopefully cover, but. Find out. About that. Once again, send me an email.
Okay.
Okay, please, thank you.
Sorry, I just need to say that I'm going on vacation, so.
All right, good for you. You deserve that. Quickly, Bob, do you want to say anything about adults?
Very briefly, we did meet yesterday. We have. The legend could not be there. But it's a new committee and we're fumbling along as best we can to form it. So we had a number of questions. I'll just read it. We discussed, do we need a statement of purpose for that group? Because we got one.
Okay, great.
Well, no, we don't need one. Okay. We want to tie into the older adult population within behavioral health. We had some conversations there. And the MHSIP consumer survey for older adults is Vern wants the results of that survey. So we'll have to learn how to get those. And the behavioral health supervisor, old adults program and their staff, we want to be able to, so that we don't duplicate services and step on toes and stuff, we want to find out where we fit. Again, it's a new committee, it's never been done, so we need to birth it. So we also need to discuss potential members of the committee in the future from the community. All of this needs to be discussed. So we have another meeting that's for June 10th, that's 317 3rd Street, Suite 6. And I have the minutes that I do.
Your secretary nicely forwarded this.
And yes, we have a pair of Lauras and we designated one of Laura Lynn, so we know the difference between who we're talking to.
Name alert.
Thank you.
Good job for getting that off the ground.
I don't know that it is.
Okay, it's going. You had your first meeting, that's all. That's good stuff.
Pretty good.
Yep. All right, I think there's, we already heard from legislative committee, so I don't think there's anything else on that. Chair, vice chair, Kelly's gone, I don't have anything. Any updates on NAV Center? I don't think we have anything new. We've heard a little bit about care for crisis triage, anything new? No? All righty. Future items, I actually have a list, so, I think we're good through the end of the year for our meeting topics. But again, I will encourage anyone who has any thoughts or questions to send me an email because I will respond. And with that.
Quick, too.
Two.
Legendary quick.
Put the kibosh on that. At 2:10, I adjourn this meeting. Thank you for coming. Appreciate it.
Sorry to hear.